I always knew I wanted to be a nurse. Taking care of other people was kind of in my DNA. And then when I was diagnosed with cancer, it was all of a sudden my turn. I was on the other side of needing to be taken care of myself.
This is just going to be over in a month.
My name is Lauren Aloisio. My first Descents nickname is Athena, and I am a registered nurse. I was born and raised in Massachusetts, and my family had a house out in Western Mass on a lake. Being out on the lake is a way to reset, recharge, and really to escape.
Don't be what they want to see.
I'm the oldest of my siblings, and so I always kind of took care of them and then always wanted to take care of other people. My mother is also a nurse, and when I remember a story when I was little, my brother dislocated his finger and I had to take care of him, and my mom kind of planted the seed and said, you know, you did so well with that, what do you think about maybe being a nurse someday? And so from an early age that I knew that I wanted to be a nurse and be able to help people. In 2015, I had recently gone to the dermatologist. I had a spot on my arm that looked a little funny, but the dermatologist wasn't too concerned. And I was at work and decided, hey, you know, I should look up and see what the results were. I pulled up my chart and I saw malignant melanoma. And my first reaction was, that must be some sort of mistake. I was 27 years old. How could I have cancer? And so I had surgery, and the waiting game after surgery was quite challenging, considering that it was basically seeing if things were okay or if they were going to be worse. And unfortunately, it did spread to my lymph nodes. And at that point, I knew that this wasn't just skin cancer. This was certainly something bigger than I had ever imagined. Fast forward again, and I had surgery to remove all my lymph nodes to make sure that there was no more cancer in my body. And the good news was that there was none left in the lymph nodes that they took out. However, the next steps after recovering from surgery was medical treatment. I knew that what I had ahead of me was going to be a bigger challenge than surgery. I was so desperate to get back to any sort of normalcy because I just love my job as being a nurse so much that I wanted to go back. And fast forward through my month of IV infusions, and I went back to the ICU where I worked at the time. I remember not really being able to smile, and I remember feeling so down and so depressed and alone, really, really alone. I had amazing supports in my life. I had my family, I had my friends. Most of my coworkers tried to understand, but there wasn't anyone who really got it. I remember earlier in the year, my friend and I had gone to a young adult cancer conference at Dana-Farber in Boston, and they had pamphlets strewn about. And I remember one sticking out to me in particular, and it was First Descents. And it was a nonprofit organization that offered adventure trips for young adults affected by cancer and chronic illness. And I have to say, I was so hesitant to go because I felt so crummy. And then I went, and it was the best thing I ever did. When I arrived and I met all these young adults from all over the United States who were my age, who understood what it meant to have cancer as a young adult, I felt like I had found my family. That was the first time that I really felt happy since I had been diagnosed and that I had been going through treatment, and it was such a dream. So my Patagonia trip, I One of the best parts about it was that we didn't have any cell phone service, and when we had left, we had heard of COVID. As we were starting to come back to reality and people were getting cell phone service again, it was starting to creep back in, like as if something not so great was happening in the world. And I was getting a lot of messages, and one message that stood out to me was, "Where are you? The world is ending. You need to come home." The fear really started to sink in. I knew as a nurse that this was never gonna just go away. Coming back home meant something might change, that I would be going back to where I came from, which was the ICU, to help take care of and prepare for patients that were going to need ICU level care for COVID. And I was right.
Going in for my first shift in the ICU, I have no idea what this is gonna be like.
If anyone understands what it's like to go on a first ascents trip, there is a high, there is a emotional freedom that happens, and then when you come home, it feels a little empty. So coming off of an incredible 10 days away in Patagonia, Chile, to lockdowns, to fear, to change in what my responsibility was supposed to be for my work was absolutely terrifying. And ironically, so parallel to my cancer journey. People didn't understand what we were going through as healthcare workers.
Today wasn't that bad, but I think I'm starting to understand that this isn't just gonna go away.
Gotta be honest, I really don't want to go into work right now. People are sick. People are dying. This isn't a joke.
I was in the ICU for about 3 months, and then it was decided that I could go back to the infusion clinic. Then I was taking care of my cancer patients who weren't allowed to have visitors, weren't allowed to have anybody else in the room with them, weren't allowed to take off their masks, and weren't allowed to see my face.
I think that's probably the biggest part of this all this is that the whole point of it is to make sure that people don't feel so alone and they understand that, that it's hard, it's emotional, and it is raw, it's real.
Transitioning to oncology during the pandemic created an opportunity for me to offer a unique perspective in that I understand what their journey might be like, and that I sat in those exact same chairs too. One of the first things that I was so gung-ho about was always telling everyone about first ascents. I heard that programs were starting to open up again, and at this point I had applied to be a medic. In particular, one patient I remember meeting, Michael. He came on the trip, and I remember smiling during a campfire, thinking that this is a beautiful experience to be able to share with one of my patients.
I think that's the biggest thing, is that they just get so overwhelmed, at least I did initially, and still to an extent, about all the information that comes on you, and then First Ascents is able to kind of pick you out and put you back into I don't want to say a normal life.
Well, it's like you are amongst people who understand.
Exactly.
And so I think that is probably one of the key parts about First Ascents, is just that sense of community is just so powerful.
Society thinks that people that get a cancer diagnosis, they can't still live. I think First Ascents realize that no, they can live, and here we're going to give you the opportunities to show that to people, that you can actually still go about there, and not to be kind of cheesy, but outliving it. That motto is I love it.
First Ascents has this way of joining adventure with nature and being able to experience the beauty around us, and also challenge us in the sense of doing things that you never thought you could do before. And I know personally through going on whitewater trips with my family, there was always those moments that really kind of scared you a lot, but it was so fun. And I know I've personally experienced that with first ascents to the point of that thrill, that adventure thrill that brings you so much joy and so much laughter. I remember hearing that First Ascents was going to offer programs for healthcare workers, and I thought, what an amazing idea, because I know how much I felt like I was so supported during my cancer journey with First Ascents, and to be able to think about that parallel being in healthcare and during the pandemic, having a First Ascents trip for healthcare workers just made so much sense. It's an organization that is just so near and dear to my heart, and I will forever be grateful